Cerebrovascular Accident by Amanda Hughes. Today, we will be discussing cerebrovascular accidents. Cerebrovascular accident is the medical term for stroke. A stroke occurs when blood flow to a part of your brain is stopped either by a blockage of a blood vessel or the rupture of a blood vessel. An ischemic stroke is caused by the blockage of the blood vessel, whereas a hemorrhagic stroke is caused by the rupture of a blood vessel, as you can see in the picture to the right of the screen. In both cases, part of the brain is deprived of blood and oxygen, resulting in death of the brain cells. If you're having a stroke, it's critical that you get medical attention right away. Immediate treatment may minimize the long-term effects of a stroke and even prevent death. Some of the signs and symptoms of a stroke are difficulty talking or understanding words, severe unexplainable headache, loss of feeling or strange feeling on one side. A lot of times it might be described as a numbness or a tingling, sudden decreased or blurred vision, weakness of the face, arm, or leg on one side, unexplainable dizziness or loss of balance. One thing that I did not put in this PowerPoint that I probably should have is sometimes patients might even feel confused. They might not be able to speak to you even. According to the American Stroke Association, the best way to recognize the signs of a stroke is with the FAST approach. F for face drooping, A, arm weakness, S, speech difficulty, T, time to call 911. Again, it is vital to ensure that you receive medical attention right away, which is where FAST comes into play. As we previously discussed, there are two types of stroke. So depending on the type of stroke and your medical provider, it depends on the type of treatment in which you receive. The only FDA-approved treatment for ischemic strokes is tissue plasminogen activator, also known as TPA, which is an IV given through the arm. TPA works by dissolving the blood clot and improving blood flow to the part of the brain being deprived. TPA may improve the chances of recovering from a stroke. A significant number of stroke victims don't get to the hospital in time for TPA treatment, which is again why it's so important to remember the FAST approach. Another treatment is an endovascular procedure, also known as a mechanical thrombectomy, which is strongly recommended, in which trained doctors try removing a large blood clot by sending a wired cage device called a stent retriever to the site of the blocked blood vessel in the brain. To remove the brain clot, doctors thread a catheter through an artery in the groin up to the blocked artery in the brain. The stent opens and grabs the clot, allowing doctors to remove the stent with the trapped clot. Special suction tubes may also be used. The procedure should be done within 6 hours after an acute stroke and only after the patient has received TPA. The good news is that 80% of all strokes are preventable. It starts with managing key factors, such as maintaining a healthy diet. And instead of eating the bag of chips, eat some spinach. Instead of always eating red meat, switch it up with some fish or some turkey or chicken breast. Chicken breast is amazing and there's so many different ways that you can cook it. Avoid alcohol. Okay, everybody likes to celebrate every now and then with a drink. Just don't make a habit out of it. And if you can, avoid it at all costs. Tobacco use. We all know tobacco use is no good. There's never a time for tobacco use. Regular cardiovascular exercise and strength training. It is vital for a human being to maintain exercise in order to ensure homeostasis throughout the body. Yes, there are days when you are just too tired and you want to come home and you want to sleep on the couch, and that is fine in moderation. Everything in moderation, including moderation, as Oscar Wilde would say. As long as you are getting out there and doing some kind of cardiovascular exercise or strength training at least 5 days a week. As we previously discussed, it is vital to receive medical attention right away. The sooner that you receive medical care, the less likely you are to have short-term or long-term deficits. 9 out of 10 victims, however, have some kind of side effect, whether it's long-term or short-term. Some of these side effects may be difficulty swallowing, inability to pay attention, loss of balance, vision loss, mood swings, some form of paralysis. A lot of times there is usually some form of paralysis. There are a lot of people in the world that you can see visually that, oh, they've had a stroke. Again, that's why the fast approach is so important. Well, that pretty much sums up cerebrovascular accidents. I hope you enjoyed my PowerPoint. This was my first PowerPoint ever. I thoroughly enjoyed making it, and I look forward to improving my PowerPoint skills. Thank you very much.